from writer-director Rian Johnson.
The Holy Grail, a perfectly impossible crime.
Wake Up Dead Man has critics singing its praises.
God help me. Anything else?
It's a deliciously entertaining mystery.
That's nice.
It's certified fresh.
It's a miracle.
Okay, you're freaking me out now.
It's the best Knives Out movie yet.
This case is solvable, right?
Oh, you'll see. It's fun.
Wake Up Dead Man, a Knives Out mystery starring Daniel Craig, now playing on Netflix.
Hi, it's Eva Longoria, and let's be real. After 40, we should ask for more from our skincare. I swear by Revitalift Triple Power Moisturizer by L'Oreal Paris. With vitamin C, pro-retinol, and hyaluronic acid, it reduces my wrinkles, firms, and brightens. And it's not a procedure. It's just a hardworking moisturizer.
Revitalift Triple Power Moisturizer by L'Oreal Paris. Grab it today in fragrance-free or with SPF 30. Available at your local Target.
Welcome to the Dr. Raj podcast with Dr. Raj Dasgupta, a show all about educating patients, students, and aspiring doctors about better patient care. Dr. Raj is a quadruple board-certified physician and associate professor at the University of Southern California. He was a co-host of the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
Hi, and welcome to the Dr. Raj podcast. And what is this a podcast of? It's a podcast of happiness and wellness, amazing people, amazing stories. And yes, there is medicine always sprinkled around. And today we have an amazing guest because this person's profession, their job, is to put a smile on people's faces. We have a dentist. And I got to tell you, because it's my podcast, I get to pick the most special people in the whole world. And this is not only my dentist, she is just a wonderful, loving, good-hearted person. And that's what the Dr. Raj podcast is all about. And today's topic, I kind of, argued in a nice way with her about what the topic should be, but she actually has a really cool topic. It's called nose breathing versus mouth breathing. How is that? I know you're pumped up. I know you want to meet my guest, but you know the routine. I got to read the bio first, and then we'll do the introduction, okay? So this is Dr. Azin Rezaei, the founder of Flint Ridge Dental Group. And she is a highly experienced and dedicated dentist with extensive knowledge spanning over 24 years across all aspects of dentistry. Her unique expertise extends to understanding the intricate relationship between posture, airway, breathing, obstructive sleep apnea, and of course, some oral health. Dr. Rezaei's practice is firmly rooted in the concept of, and she put this in quotes, total body wellness, end quote, recognizing the profound connection between oral health and overall well-being. She believes poor oral health can lead to a cascade of health issues. She lists heart disease, COPD, high blood pressure, sleep disturbances, stroke. Oh, that's horrible. And diabetes. And of course, there's other much more besides this. Furthermore, Dr. Rezaei is a trailblazer in the field of holistic dentistry, excelling in the diagnosis and treatment of diverse oral diseases, including malocclusion, bruxism, TMD, which is temporomandibular disorder, and improves the overall quality by identifying and treating the root of the problem. Her specialization in minimally invasive procedures and safe mercury removal, along with her commitment to restoring teeth with biocompatible materials, reflects her dedication to providing patients with non-invasive and holistic solutions. And with that being said, Dr. Azin, how are you?
Hi, how are you? I'm very thankful to having me today, and I'm so happy that I can talk about the very important subjects that bring the awareness to your audience, that is a nose breathing versus off the mouth breathing.
Well, just to embarrass you a little bit, you look wonderful today.
Oh, thank you so much.
Now, this is unique, right? Because usually I tape this over Zoom, but we are right next to each other. You can't see it, but trust me. And the dentist, you look great.
You always just saw me on the scrub, but today I'm just, a different way.
So let's go to the basics, to kind of like the meet and greet, right?
Yeah.
You're Iranian.
Yes.
My wife's Iranian.
Yes.
You could have been anything in the entire world. Why did you go the route of dentistry?
It's very interesting, question. And to answer that, when I was, in the age of 16, 17, I was, painting, sculpturing, and I love to do it. Still, you can see on the wall that I have a lot of my painting, and I love, medical as well. But I want to just, combine and merge these together. And, the dentistry is not just about medical. You're just working on a very little small piece of, tooth, and you have to carve it. You have to just, build up to the natural anatomy. So I think that's my passion, to just make a beautiful smile, create a beautiful smile. And it's rewarding for me when I just give the patients, the mirror, and they can see their smile, they get a confidence, they feel that they're, passionate to just, talk. And I feel this fulfill my dream.
Aw. Wait, come closer over here. I want to make sure they hear all your statements, okay?
Sure.
So, topics. You couldn't take it easy on me. You could have talked about root canals, which you gave me a couple. You could have talked about doing fillings, but you wanted to talk about nose breathing versus mouth breathing. Sure. And now you got me really into it. So why this subject matter, and why is it so important to you?
Yeah, I will definitely talk about it. Just a little about me.
Oh, okay.
Mother of 2 kids. 2 children, and I've been practicing more than 24 years, as you mentioned. And back on 2010, I had this opportunity to open my own practice, which gave me this, freedom to learn more about the holistic approach that can help my patients to get to the root of their problems and overall health. But my journey with the breathing and airway started with my daughter. So my daughter, when she was very young, and I'm noticing that during the night she was grinding, very heavy grinder, and had some sort of heavy breathing and clenching. So I was so, concerned, but no one can tell me what's going on. And I'm noticing that when I've done the homework, she couldn't completely focus. Anyway, one of my mentor, I was talking to her, and finally she said that have your child or the daughter has been diagnosed for maxillofacial deficiency, and does she breathe with nose during the night? And I was like, what is she saying? I never heard that in dental school. And it was very new to me. But ophthalmologist, we took her to get diagnosed and start the treatments. And I saw, amazing, difference on her sleep and breathing pattern. The most important thing, she didn't, the grinding stopped right away. So I thought that I can help my patients. And it was a new chapter in my life that I started just, attend to a lot of conferences and classes. I met a brilliant mentor in my life, which they show me the path. What is that? Why, the nose breathing is that important, and why the mouth breathing is not. I will tell you that the mouth breathing is one of the most harmful things that human being can do, and it causing a lot of problem with unheard and undiagnosed.
So this is personal. I mean, this is your daughter.
Oh, yeah.
And by the way, does she know that we're talking about her?
Yes.
Am I going to have to get consent or anything like
No.
that?
No.
I'm just teasing. I'm just teasing
She
you.
is completely aware of that. Yeah.
No, but I love stories that actually have a personal feel to them.
Oh,
I didn't
yeah.
even know that. And I'm sure she's lucky to have a mom like you.
Oh, thank you so much.
So let's go from your daughter to the patients. You know what I mean? So this mouth breathing and its manifestations, do you see this in your patients on a daily basis?
Oh, yeah. I see patients every day with, having a head and neck pain, jaw pain, gum recession, bruxism. Bruxism is a fancy word for clenching and grinding. Poor sleep, fatigue, chronic, allergies are often have the same root of the problem, which is undeveloped midface, and jaws, which is combined with the dysfunction of breathing. So from the first breath at birth till the final exhale that we leave our body, we depend on our airway, bottom line. However, today we have an under-recognized problem that affects our ability to breathe in a healthy way. What if I, Raj, tell you that we can prevent disease in a very simple and easy way, which can positively impact our organs, heart rates, sleep, and even our mood?
You know, I'm going to be on board with that, because what we share in common is just doing the right thing for our patients. You know what I mean? And I think in this day and age where everyone's going to be on a medication, a drug, a prescription, hey, you don't have to convince me.
Yeah.
I'm on board with that concept.
So the best advice is close your mouth, breathe through the nose.
I'm doing the podcast. I'm just teasing you. But anyways, I do believe what you said. I think, breathing, diaphragmatic breathing in through the nose, out through the mouth. I mean, yeah, I wish everyone could easily do that, but they can't, right?
Yeah. And the question is, why? Why this, nose breathing will just, change to the mouth breathing? So be patient with me, because I have to give you some introduction about it to just, analyze what I'm saying. Our face is changing due to unavoidable modern life. What I say is the modern life just, brought a soft diet. And the soft diet is one of the main problems that we encountering with, feeding the kids or infants and adults. So let's go back to this situation that when I see, the patients, and I'm noticing they have a dry lips and they have a dark line under, their eyes, or they have heavy breathing, they have a bruxism, they have a sensitive gum, worn off enamels. All these things, or the most important thing I forgot, the high wall palates, scalloped tongue, I cannot ignore it anymore. And I know this is a beginning. So let's just, step back and talking about a soft diet and why the soft diet, it caused this. Let me introduce you to Dr. Robert Guccini.
I don't see him. Is he here? So what did this doctor do?
He was an anthropologist that he did almost 30 years of the research and written a book and articles. However, today I just want to focus on his fossil studies.
Okay.
He did the studies on the fossils about 400 years ago and compared to the modern skulls.
Sure.
And what he found was that the fossils, the skulls, start to shrink. Means that they was pretty big and they had enough room for 32 teeth. But the modern, skulls shows pretty small, and the rate of the malocclusion, which is another fancy word for crowding on when the teeth are not belongs to where they are, we call it malocclusion. The rate goes higher.
Okay.
Also, he started to just did a lot of research on the population, which there are an isolated area. What I'm saying that means that the modern human, they're just, in the isolated area. What he found that they have a bigger jaw and bigger, nose pad. So what he found is their diet is different than us. They're just chewing in the hard diets. So one of his, founding that the soft diet from the beginning, it doesn't let the whole, maxilla facial, which is another, fancy word for the face, mid-face, is not fully developed. So basically, this 1/3 of the face, it has more growth rather than the other part of the face. And we're looking forward to having more forward and downward. That which happened between age of 12 to 17. Around age, 12, 85% of this happening. But we don't see it more often on the kids. When they not fully develop, what happened is just, not letting the whole airway to just, develop completely. So on the other hand, we'll see that these people are starting to have a mouth breathing, and I will talk about in details. But let me tell you something. Let's start with the infant. We not breastfeed for 3, 4, 5 years. We start, breastfeed for maximum or 6, and then the child is lucky or baby is lucky about a year. But in the past, we used to breastfeed. And the breastfeed about 400 years ago, look at the nipple. And then when the nipple goes to the mouth, is park the tongue in the proper position, which is on the roof of the mouth and seal. So the tongue and all the maxillofacial muscle, they have to work hard to get the milk.
Mm-hmm.
So they have to just have a lot of activity, which they make it pretty hard and strong muscles. So consider the tongue is a roof of the mouth. And the roof of the mouth and the infant is pretty soft. When the muscles start to just pushing, it has the chance to become wider. When it's become wider, the mandible or the lower jaw that is under control of the maxilla start to just moving forward and downward. In other words, the airway start to have a good growth pattern. But what we have now, we have bottle. So what is the difference the bottle feeding and the breastfeeding? The bottle feeding, it just not let the tongue goes up to the top because it doesn't need it. Tongue said it's easy come, and I just step back. So it's moved the tongue downward, and the milk is just getting very easy. So the muscle said that why we should have to just go work out. So the muscle at the end has become pretty weak. When their muscle, the maxillofacial muscles become pretty weak, the bone that needs to have the stimulator to make them grow, they won't grow. Be patient with me. We talk about the tongue and the palate. That is the roof of the nose because the maxilla is just not a part of the arch. It is in the floor of the nose. So when the maxilla won't completely get wider, what we have here, we have a palate. So it's like we have a scaffold for the maxilla, the tongue, the scaffold for the maxilla to grow. Mm-hmm. But when don't have this, it wouldn't grow. It's like this roof doesn't have a support. What happened is going to collapse. So we have a high vault palate. What happened then? We have a septum here, and we have a high vault palate. It will just make a shift. We're going to refer it as a
deviated septum.
Perfect. You're pretty smart. But consider the maxilla is a lateral wall of the nose. So when it's not, have a fully growth, we have a very tiny walls. So then we have obstruction in the nose. So the body will compensate and have a mouth breathing. So bottom line, you remember I told you, the fully grown maxilla and mandible, let everything to just become in the right position. So we have enough room to breathe. And when we don't have it, it will change. But what then? Why we say this is not healthy? Let's get to this point. Are you ready?
Well, are we going to go to the next question? Because I think we could incorporate the next question with that then, right?
Well,
Which
yes.
are going to be we're going to be some of the signs and symptoms based on what you're saying.
Yes.
Correct?
Perfect.
All right.
Good.
And don't ever say I'm not patient. I was super patient on that
you
one.
are patient.
So, I mean, you just saw my expression. When you said, well, in the day of the caveman, I'm like, oh my God, where are we going with this? But no, I think that in summary, it makes sense. I didn't realize our dietary changes, incorporating breastfeeding, that was very interesting. But now that we talked about how we, now mutated is a really scary word, but how we changed our craniofacial anatomy, and now we are more mouth breathing, what are the symptoms? And how can we notice the signs of mouth breathing, especially in children?
Perfect. You use a very fancy word, craniofacial. So craniofacial stands for skull and the face. Mm-hmm. So the craniofacial has a main role of this whole system. Let's just, go back. We're talking about the tongue position. We're talking about the maxilla and the mandible. Now let's talk about the nasal cavity. The nasal cavity has a very main role because it's warm up the air. You know better. You're going to just purify the air and humidified way. As soon as the air goes through, the nasal, passage, the nitrous oxide is going to inject it to it. It's antibacterial and antivirus and antifungal, which is make it pure. So basically, the nasal cavity, it will make the air ready for the lung to have the optimal oxygen absorption. Am I right or not?
Of course. Going into those lungs, that air definitely needs to get diffused to go in our body. But I'm not going to let you escape for this. What are going to be those signs and symptoms? You know what I mean?
Exactly.
Okay.
So when they start to go through the mouth, so the air is cold. And as where it goes to the throat. Where we have it there, we have adenoid and tonsils. So they come so irritated because they're not used to have a cold air. So we see a lot of, adenoid on the kids, they're swollen. Second, because it's not purified, it's making upper respiratory infection. So we'll see they just, coming back and they're just noticing they have some sort of infection. Am I right or not? Because you're an expert.
No, but you are the guest. I do like the way you're going with this. Okay, yes. So we see more infections in kids, definitely upper URIs, what you're saying. We see the adenoids, which is going to be a tissue that actually disappears after a certain age, but they have tonsillar properties. You're seeing a lot of inflammation, inflamed tonsils, inflamed adenoids. That obviously could lead to some sleep apnea in kids in itself. What else can you get besides those?
Okay. So when we starting to just having the mouth breathing, what happened then, we just, get a lot of volume of the air goes to the lung and we dump more air out. So it's going to decrease on the carbon dioxide. So when the carbon dioxide goes, the level goes down, what happened? You know that the carbon dioxide is a vasodilator.
Oh, a vasodilator.
Vasodilator is a fancy word for vein and to make it bigger. So on these kids, what we see is a dark line around their eyes, around the orbits.
Interesting. Okay.
Yeah. And also they have a bedwetting because the amount of the oxygen will decrease. And when they have this amount of oxygen goes down, the brain thinking that they're going to choke. So their body goes to the fight and flight. And as you know, these situations make a bedwetting. It's very common when I see these patients on my chair and look at the mouth and I'm just turn around and ask the parents, does your child has a bedwetting? They were like, how could you say from look at the mouth? Can you see the relationship?
Yeah.
Because no one advertised that my child has a bedwetting.
Of course not. Oh, well, they came here to get their cavities filled.
Exactly.
Why are they going to talk about their kids?
And when I opened this conversation, they were like, no one talk about it. How could you say and what we can do? So these are the symptoms that we can see on the children. And as a dentist, we are the only professional that can just see the first sign. And if there is a technique or appliance that make a proper jaw position, make a proper jaw width, and deliver amount of oxygen that we need, and make the structure to just fully growth and develop, then what? I can make a big difference in the 12 months for the patients. So before this child become an adult with the obstructive sleep apnea and 100 more problems, we can stop that in the very first stage of the living. But we have to look at every single thing and put these dots together. Let me tell you something that is very interesting. Dr. Catherine Manock, she did a brilliant research on the 11,000 kids that they suffer from a sleep disorder. What she found, they have all common symptoms. The symptoms, trouble for learning, trouble to cooperating at the school, behavioral problem, hyperactivity, but it comes to your mind.
Well, we talk about ADHD, unfortunately.
Exactly.
Yep.
Exactly. So the risk of having a mouth breathing and getting an ADD or ADHD will raise up. So the child that has a poor sleep for many years, go to school, trouble learning, trouble, very calm situation, start to misbehave, and they're just, having some sort of not communicating well. The calls ring.
Mm-hmm.
And the parents being asked to just take the kids to just, find what's going on. And the doctor will just, diagnose for ADD and ADHD, which the result is not quite a bit, right. It could be something else, but the solution is pharmaceutical, which is a stimulant. We know that, which is make, the child become calm and numb, but not make any difference on their sleep. And it's so sad. So I want to just bring your attention, if your child has the symptoms, please look at their airway, look at their sleep pattern, look at the other symptoms that I talk that might have the root of the problem somewhere else, but it shows that have some symptoms like ADD and ADHD. I'm not saying that all the ADD and ADHD have a sleep disorder, but the chance to have the ADD and ADHD with a sleep disorder is much higher.
Oh, that was interesting. And my question to you is, where do you have time to teach these kids how to just floss and brush their teeth with all this going on?
It's not my job. I have a hygienist that she does this for me.
Okay.
Yeah.
Now, I mean, that was an amazing answer. And I actually want to jump to this question over here, which is going to be, now that we talked about the root cause of why this happened, which is very interesting, well, how do we address these things? This is going to be the most important, right? So, what happens when the oral muscles, like the tongue, can't become strong, and the jaw growth? You're just not going to suddenly snap your fingers and the jaw is going to expand and have a big airway. What are things that we can do?
Yeah, that's a very, very good question. Let me answer to that. So we talk about tongue and the muscle, maxillofacial muscle. Okay, they need to become strong, which they can't. So consider that the tongue has a main role for swallowing, and it needs to just go to the roof of the mouth because that's the main, part that it needs to park. But if it cannot go to the roof of the mouth because it's not strong enough, and the muscle that needs to help it to just swallowing the food, again, is not strong enough, you need to recruit other muscles like a cheek, like lips. So if you see the child, they're just having open mouth and they're eating, means that they're recruiting other muscle for swallowing, is another sign. So the most important thing is to make sure if they're having this situation, we have to reprogram the muscle with another, way. We call it myofunctional therapy.
Okay.
Which is helping a lot to make the muscle become stronger.
So let me interrupt right there. So myofunctional therapy, meaning muscle. What? Give me some examples of that. Give me some myofunctional therapy. What do you do?
So for myofunctional therapy is sort of, we have a Zoom meeting. The patients and, the therapist. Sure. They starting, for instance, to just, teach them where the tongue has to stay. They have a lot of practice. Okay. One by one, they have to just follow that, practice. They have to just, for instance, just, hold their tongue, bring it down, go back, and just hold it on some position. They have to start to just blow, the balloon and just, make the muscles start become very active. So based on their, exercise that needs to be doing it every day, 3 times a day, and each time is 10 minutes, which is comes to 30 minutes a day, and just, adding a day and a week and a month, you will see the muscles become pretty active. Okay. So this is how the myofunctional therapy. Also, one more thing that we have to make sure the kids start to just, deliver the air from the nose. So before they go to the bed, we show them how they clean the nose in order to just having a better, path for breathing. Sure. And the third, that is not very funny, but it shows a big, big difference. We put the tape on their lips. Okay. Yes. And it's worked pretty well. Yeah. So we train them to reprogram, rewire, and refire the muscle where they have to go and how they have to function.
Now, where do you fit in here? Because this is great. We're talking about the myofunctional therapies that you're doing. Now, you're the amazing dentist, so where does your role go in? Is there anything that you're doing as the dentist? Because it's all started with you. You're in the chair. They open the mouth. You see all these classic signs and symptoms. You talk to the parents.
Yeah.
Now, are you going to be doing a lot of the myofunctional, or are you going to be doing other dentistry things to make them better?
So that's another very good question. First of all, I have to just tell you that this is not something simple that I can jump to the treatments. The treatments is appliance that we just, have this opportunity for the bone stock to get wider. But prior to that, we have to fully scan the patients from the 3D images, because I have to look at the airway and see where this, obstruction comes from. Sometimes I have to send the patients to the ENT to find out if the patient has an allergy. Where is the adenoid? How is the adenoid, function? And or sometimes I have to send it to the chiropractor, because these kids has to move their head forward to open the airway, so the posture is pretty canted and tilted. They have a lot of pain. So, but starting with getting a lot of data from the patients, we're gonna just do the full screening, and then 3D scan and the sleep test is another things tools that's going to help me a lot. I'm not interpreted. I have the MD doctor and the sleep doctor. They're going to just send me the report. Based on that, we can just find out if the patient has some sort of AHI that needs to be be concerned.
And AHI, for those who don't know, apnea, hypopnea index. Okay, yes. I like that. Sounds good.
And then after just, gather all this information, I had a questionnaire for the parents. I wanted them to just give me some information about, how this child behaved at the school, and how they just look at him or the patients, that how they're eating, how the way that they're just breathing. Pay attention. And they bring the questionnaire for me. And when I just put all these dots together, I can make, custom plan for the patients and start with, the appliance. So the first appliance, you can't believe it, my very youngest patient is 3 years old. And we're programming the tongue. It's a very simple plastic we just put in the mouth. And we start to just moving the way the tongue has to be. So we're not going to start with the, very extended treatments. It's just a small, steps till we comes to the point that we have to completely expand the maxilla and deliver, the oxygen in a better way. So it takes about 12 months to see a big difference on the patient's, the craniofacial pattern, breathing, and the most important, they starting to just be more focused. And what I hear from my patients, their kids is more energetic in the morning.
Nice.
Yeah, they said they're not very puffy and just tired. They're more energetic in the morning, and it's rewarding for me. It's so rewarding for me.
I'm going to summarize what you just said, because I'm kind of processing it. So this is actually really, really cool. I'm not just saying that because you're my guest today. I mean, number one, I think we talked about finding those signs and symptoms that go under the radar. Yeah. And your theme is, hey, sometimes it's the dentist that notices these things and not other individuals. You start off with a lot of, lifestyle changes, myofascial training that has a lot of benefit, very little side effect. But you do a multidisciplinary approach to each patient. And that can involve an ENT doctor, someone like me, a sleep doctor, could involve a chiropractor, all these people.
Yes.
And it sounds like everything in medicine is very individualized. But these plans, it's going to be, it's going to be around almost a year commitment about what to go into. Yeah. But starting early is definitely the way to go, because it's the way it is. So did I summarize that pretty well?
Perfect.
Okay.
You did a great job, as always. Yes.
I think that was amazing. That was amazing. So let me just say this, as we're getting closer to the end. I just, when I do you, I just think you're just the nicest person dentist. I think these are all bonus things that you have. I just want to say this on the podcast was, what really made me want to put you on the podcast is your big heart. Remember, I had tooth issues?
Yeah.
And I called, you weren't here. I get a call back. I'm like, where are you calling from? You were calling from France.
Paris. I was in, Charles.
Yeah. You called me on your vacation. And I just,
of course, I do it all the time for my patients.
That's when I just knew you're a good person, and I wanted to say that. So with all these amazing training you have, what is the next step for Dr. Azin?
Very, great subjects. I want to just, get my whole practice for this main issue that we see on the kids and adults for sleep, breathing, and airway. I'm hoping that I can just, first of all, bring this awareness to the community and the society, because happy child, happy family, happy, society, first of all. But if I can just, make that happen, and I get, sort of help and getting to the schools, getting to, some sort of facility that they have kids and they're suffering from this problem, we have to get to the root of the problem, no matter what. Any child has a lot of potential to grow and be happy, not surviving. Most of our kids are surviving mode. So this is my mission, and I'm hoping that God can help me and just, open this path for me to just help more people.
Oh, I love that. I love that answer. And let me just say this, that, we're at the end. Thank you for being on the podcast today.
Oh, thank you so much. I appreciate it.
And you know what, Dr. Azin, this is her. She is honest. She is passionate about this. She truly is a dentist who goes down to the root cause. And I hope everyone got something from this today. And let me just say one more thing. Do you have a website? Do you have anything?
Yes.
Can you just tell my fans, my listeners, what is it? What is it?
So it's Flint Ridge Dental Group. Flint Ridge is F as in Frank, LINTRIDGE, dentalgroup.com.
Nice. All right. We'll put that in the show notes. So everyone, hey, I hope you enjoyed this episode. This is going to be nasal breathing versus mouth breathing. I hope you loved it, and I'll see you again in the next couple of weeks.
Thanks for listening. This has been a production of Ars Longa Media. Our producers are Madison Linden and Chris Brightigan. Our executive producer is Dr. Patrick Beeman. This podcast is for educational purposes only and not intended for medical advice. Ars Longa, Vita Brevis.